welcome back to my channel. So in this video I'm gonna give you a very simple way to understand internuclear ophthalmoplegia and the MLB. So let's get started. Alright, so here is your right eye and here is your left eye. Let's say you wanna look to your left. So what you're gonna do is you're gonna move the lateral rectus muscle of your left eye, abduction, which works by the abducens nerve, and you're gonna work your medial rectus muscle of your right eye, which works through the third cranial nerve, the oculomotor, right? So in this way you will be able to look to your left. Now what mediates left gaze is the right side of your brain, so it's quite the opposite, right? So if you want to look to your left, it's the right side of your brain that's gonna work, not the left side. And let's say I want to look to my right, I want to look to the right side. So what's gonna happen is the right lateral rectus muscle abducting the eye through the abducens nerve, and the left medial rectus muscle will adduct the eye through the third cranial nerve oculomotor to mediate right gaze. This is called conjugate eye movement. Now, which side of your brain mediates right gaze? It's the left side of your brain. Now, how do you think the brain coordinates both of these movements together? It has to activate the nucleus of the sixth cranial nerve at the same time that it activates the nucleus of the third cranial nerve of the other eye, right? So there has to be fibers mediating that. And these fibers are found in the brain stem. And so here, guys, we have the nuclei of the oculomotor and abducens nerves in the brain stem. So in the midbrain we have the nucleus of the oculomotor nerve, right and left, and in the pons we have the nucleus of the abducens nerve, right and left. Now let's say you wanna look to your right, so what we need to activate here will be the right abducens and the left oculomotor, right? Who mediates these? Something called the medial longitudinal fasciculus. So what happens is that the left side of your brain will send to a center here mediating conjugate eye movement in the pons called paramedian pontine reticular formation, because it's found in the pons. This center will send to the abducens nerve of the right eye if I want to look to the right, and this will activate the lateral rectus of the right eye. Fine. Now I still need this eye to move with me. I still need the left eye to move. And so the abducens will actually send through the medial longitudinal fasciculus to the left eye, asking it to move medially like this, activating the oculomotor nucleus of the left eye. And so in order to move your eyes to the right, I activated the right abducens and the left oculomotor. These fibers ascending through the brainstem are called medial longitudinal fasciculus or medial longitudinal bundle. If there is a lesion affecting the medial longitudinal bundle of the left side, you will not be able to look to the right. So a left-sided internuclear ophthalmoplegia means I can't move my eyes to the right, and vice versa. And this happens mainly with multiple sclerosis because these are highly myelinated. Let's take a look at how this looks like. You can see here, guys, that this patient was able to look towards the left because the right medial longitudinal bundle is intact, while as you can see he's not able to look to the right because he has a left-sided internuclear ophthalmoplegia. He's a lesion in the left medial longitudinal bundle. Here, guys, he was able to move his eyes to the right, but when it came to the opposite eye, it froze. Freezing of the opposite eye means that means that this area is intact, but there is no coordination between eye movement because there is a disconnection here. And so his left eye here was not able to look to the right. Notice here, guys, that there is nystagmus. Even though this eye was moving and abducting normally, it still had nystagmus because it's asking, as if it's asking the other eye to join it, right? Because the other eye is freezing. Now, because we have an intact near reflex, guys, there is no problem with the nuclei of the cranial nerves themselves. There is no problem with the fibers of the accommodation reflex. So both eyes can move with the near reflex as usual.